We've considered you for ankle arthroscopy or keyhole surgery to the ankle joint because by this stage we may have tried some other things already. The kind of things we could have tried to help with your condition are physiotherapy or steroid injections, but despite that the pain persists. There are some conditions, for example what we call a footballer's ankle, where there isn't really that much role for physiotherapy and we may proceed directly to the surgery. Ankle arthroscopy is a day surgery procedure where we do it under a short general anesthetic. We make two small incisions at the front of the ankle through which one of them we can put the camera so we can look and see what's going on inside the joint, and part of the procedure or the arthroscopy is to look and see. Now we don't just look and see because we have an MRI scan for that, so what we actually want to do is treat the pathology, and we do that by putting small instruments into the joint which can remove, for example, bone spurs or pinching tissue, or we can put small instruments in to treat or try and heal or promote healing of something like a cartilage defect. We stitch up the small incisions and you have a bandage which you keep on for the 2 weeks, and we give you a simple shoe to mobilize in. The shoe looks something like this. It can accommodate the dressings, and you are allowed to usually weight bear fully on the ankle, though if we've done microfracture we may limit how much weight bearing you do. We give you crutches because if your ankle is sore, it's nice to have the alternative of not having to put it down. It is an operation, and operations have risks. Main risk here is of infection, which is very rare, but if it happens, has to be managed aggressively because it's a joint. The stiffness after the operation, we're removing often scar tissue, but some scar tissue does build up after a procedure as well. We can minimize that by getting the ankle going after the 2-week mark. You can get some numbness, not paralysis, but a little bit of numbness and tingling over the top of the foot because one of the nerves is very close to where the instruments go in. Very rare risks include arterial injury, because an artery traverses the front of the joint, which can inadvertently be damaged by the sharp instruments. Again, very unlikely. There is a risk, as with any operation, of something like DVT, but we minimize that by getting you going early and allowing you to bend and move the ankle to minimize blood pooling in the leg. After the operation, do try and keep the leg elevated because that helps with the swelling. And I'll see you at 2 weeks, and I'll also see you again at 6 weeks. I'll start physiotherapy usually after the 2-week mark, but sometimes if the exercise is very simple, I may just recommend you do them yourself. To shower after surgery, the easiest way to protect the dressing is to get what we call a cast or dressing protector. These are widely available online, and you can get it from Amazon, or even Limbo is a company that does it. It acts as a seal that goes over the dressing like a giant bag, but it's better than using a carrier bag or something because the chance of water going into the dressing is significantly reduced. If your dressings do get wet, you must contact me because we need to change the dressing. It is an operation. It has got a recovery time with it, but we try to minimize this with good surgical technique and getting you going early. If you have any worries or queries, you can always contact the office, or you can email us, or just take a look at my leaflet on recovery from ankle arthroscopy, which addresses some of the other questions in more detail.